bit wordy. Okay, so when you find a wordy case, don't lose your temper, because in the exam still you can, you can talk with the patient, and at the same time you can scroll in the notes. Yeah, so even if you find, which you are doing in the real life, you can talk with the patient and scroll it. Just
Mm-hmm.
you can tell the patient, oh sorry, I'm just double checking things. So if I lost my eye contact with you, this is important. Okay, take the permission from the patient so you will not lose mark. If I lost the eye contact, I'm not, I'm not, I'm paying attention to you, but I'm looking at your notes. I'm not seeing something else. Okay, so that's important to emphasize with the patient, either in real life, either in being an actor. Okay, because more or less actor is a patient. Okay, and he will act as a patient, so you need to treat the actors as you are treating your patient. Okay, um so I will start the 3 minutes. When you go down, tell me to scroll down or up according your needs. Okay, is that fine?
Okay.
Shall I start the 3 minutes?
Yes,
Yeah,
please.
yeah, sure. Yeah. Shall I scroll down?
Yes, you can. Okay, can you scroll up a bit, please,
Yeah,
again?
sure, sure.
Okay, up a little bit more.
Sure. Okay, are you ready to begin the
Yes,
case?
yes.
Yeah.
Okay, shoot. Hi there, hello. My name is Dr. Asim. I'm one of the doctors at the surgery. Can you please confirm I'm talking to Jack Whitehouse?
Well, no, doctor. Jack is deaf. He cannot hear you properly.
Okay,
Yeah, I'm his son, John.
okay, okay, John. Um, Thank you for talking to me. Can I confirm that Jack has given the consent for me to talk to you on his behalf?
Oh yeah, doctor, you will find the consents I think on
Okay,
the system in front of you, I
okay,
think, and they
okay.
are always putting it in the first page. So I'm not
Yes,
sure.
yes.
Yeah, yeah,
I've just gone through it. Sorry for that.
you
Yes,
know,
I
no
I can
problem.
see. I can see
Yeah,
that. Okay,
no
fair enough.
problem.
How can I help you in terms of Jack?
Well, doctor, to be honest, I'm not sure. Jack was, having now diarrhea for 5 days. It's continuous
Mm-hmm.
diarrhea.
Mm-hmm.
And thankfully, one of his carer managed to collect some, and I took it and I give it to the reception. And the reception told, they sent me an appointment today to talk with you
Mm-hmm.
regarding, I
Yes.
think, the results. I did give him all what I can, doctor. Well, I give him lobramide over the counter,
Okay. Mm-hmm.
Imodium.
Mm-hmm.
I'm giving him 3 tablets per day, but nothing. He's continuous diarrhea. He's never stopped.
Okay.
Just continuous.
Okay, okay. Thank you for telling me all that information. I can tell you about the test results, but prior to that, I'd just like to ask a little bit about Jack's symptoms other than diarrhea. Is he having any other symptoms like vomiting?
Well, he's not vomiting, but
Mm-hmm.
I think he's nauseated a little bit. He's
Is
not
he?
eating.
Okay.
Yeah, he's not. He's eating and drinking, but not
Mm-hmm.
as he used to.
Really? Okay,
Yeah.
okay. I'm sorry to hear that. What about any fever?
Well, his carer did check the fever and the blood pressure today, and
Mm-hmm.
the temperature. They told me it's normal. The temperature
Normal.
is normal. Yeah, maybe his heart rate little bit.
Mm-hmm.
Usually his heart rate in the 50s or 60s. Now his heart rate, I think, in 80s. They told me
Okay.
like that, but he doesn't have any temperature, and he doesn't
Mm-hmm.
have. Yeah.
Mm-hmm.
Yeah.
Mm. So how does Jack communicate? Is he able to speak to you all right? Because his hearing is affected, so sometimes it
No,
can affect
yeah,
speech.
he's able to do lip breathing. He know how to do
Okay,
lip breathing. Yeah.
okay. And is he complaining of any pain in his tummy at all?
No,
Cramping or
well,
severe
he
pain in the
have
tummy?
cramp. He have some
Mm-hmm.
cramp. Yeah,
Mm-hmm.
but not more than that. We give him some paracetamol for that, and I think he's
Okay.
managing.
It's okay. Okay, fair enough. And how, when you say diarrhea, how often is he passing loose stools per day?
All the day, to be honest,
All
he's
the day.
already
Mm-hmm.
we are already put we just give him some
Mm-hmm. Mm-hmm. Mm-hmm.
incontinent pads and these,
Oh,
but
okay.
yeah, because he's, all the beds are soiled every now and then, and the
Mm-hmm.
carers cannot keep it changing that, so I
Mm-hmm.
get some incontinent pads.
Mm-hmm. Apart from this diarrhea which has come on in the last 5 days, how are his general bowel habits? Is he generally constipated or does he open his bowels regularly?
Usually he's opening his bowel every
Bowels
day.
regularly.
Yeah.
Okay, fine. Now I do see that he has a lot of other conditions as well, Jack. So is he taking all his medications on time?
Yeah, yeah. Well, we have
He is.
3 times a day carer.
Mm-hmm.
Yeah, they are coming
They
for,
give all the
yeah, the
medication.
personal
Okay.
hygiene and also the
Mm-hmm.
medication, doctor. Yeah.
Okay, fair enough. Now I do see because he's a diabetic. Did you or the carer happen to manage the blood sugar by any chance?
Yeah, yeah, they check his blood sugar because
Mm-hmm.
he's not eating that much, as his
Okay.
usual. So they check his,
Mm-hmm.
his sugar, and it's always in the 7, 8. So
Seven,
it's
eight.
fine. Yeah, it's
Okay,
not a
okay.
problem, I think.
Okay, that is fine. And can I ask you that during this time, while he is having so much diarrhea, is he having any signs like of water depletion, which can include any sunken eyes he's having that you noticed?
Oh, to be honest, I don't know, doctor. He is
Okay.
skinny a little bit, so his eye
Mm-hmm,
is
mm-hmm,
always sunken. So
mm-hmm.
I'm not
Okay.
sure, but he's drinking. If this is what are you asking?
Mm-hmm.
Yeah,
Okay,
he's drinking. Yeah, not
mm-hmm.
like he used
What
to,
about
but he's
wee?
drinking.
I know he's wearing the pads, but what about wee? Is he
No, no,
passing wee all
doctor,
right?
no, no. He's for the way he have a catheter from up.
Mm-hmm. Mm-hmm.
I don't
Yes,
know what
yes, I
is the name
noticed he
of
had
the
a suprapubic catheter. Yeah.
yeah. He have catheter from up, and the catheter is fine. It is less than his usual, but it's
Mm-hmm.
working. We can see some urine coming out.
Okay, okay. And would you say that it's the usual amount, almost half, or how would you say?
No, according because they are calculating the
Mm-hmm.
care, or they said
Yes,
it's
yes.
no, it's not half. I think it's decreased little bit. So usually he's
Okay.
giving 2 liter. Yesterday he give 1.5 liter, something like that.
Mm-hmm, mm-hmm. Thank you so much for telling me all that information, and it's really helpful. Now, I'll come on to a few things, but prior to that, I'd like to ask you, do you have any ideas about what's happening with in terms of his symptoms, Jack's symptoms, and what might be the results at all?
Well, we thought it's maybe a bug, but I don't
Mm-hmm,
know why the bug stayed all of that. Usually,
mm-hmm,
with the Imodium, everything will clear up and the
mm-hmm,
things will become better.
mm-hmm.
It's
I know
becoming
you.
more.
Mm-hmm. I know you mentioned the bug. Has he recently had any course of antibiotics which were penicillin based at all for anything else?
No, no, no. He never
Mm-hmm.
had any
Okay.
antibiotics. No, no.
Okay. And is there anything that you were specifically concerned about in regards to Jack? Of course, I'll discuss the diarrhea and also the test result, but anything else?
Well, doctor, just because it's not stopping, so I'm not
Mm-hmm.
sure. His kidneys are always bad.
Mm-hmm.
And we
Mm-hmm.
have bad experience with for dehydration from before, so I'm not sure what's going on with his kidney.
Okay, okay,
Mhm.
okay. So you said but you had bad experience with dehydration. What happened
Yeah,
at that point?
well, he had severe, diarrhea and vomiting, and that's
Mm-hmm.
why his kidney was affected a few years
Mm.
ago.
Okay,
So I don't want that to happen again, to be
of
honest, doctor.
course, of course. And is there anything else you were hoping for?
No, I think just
Mm-hmm.
something to stop the diarrhea,
Yes.
really.
Okay, thank you so much for telling me all this information, and it's really helpful. First of all, obviously, as you mentioned, that he is having diarrhea, so he's having a lot of stools, more than what we would expect, as a regular bowel habit. So that's one thing. The other thing is we did get the stool results back, and a majority of the things were negative in it. Now, it shows that one of the things which is one of the bugs called as C. diff, that is not actually, they did not find the actual toxin of the bug, but they found that it is existing in the bowel, which is something that we do take normally. It exists in the bowel of everyone. So I wouldn't be considering that as something to treat. However, there are a number of other things that we can consider right now to help with his diarrhea. Would
Hmm.
you like me to give you a few options?
Yeah, yeah, sure, doctor.
Okay, so first of all, you said that he is able to drink, which is a very good sign. So maybe if you can mix up some diarrholite, which is a salt sachet that you can get over the counter, with a jug of water every time that you give him plain water. Instead of that, you can give this diarrholite, and that help replaces much of the salts back in the body. How does that sound?
Yeah, yeah, no problem. Yeah,
Mm-hmm.
I can give, but doctor, if you can find some, because I think we tried it from before and without
Mm-hmm.
taste. So if there is something with a specific taste or something, maybe
Yes, yes,
chocolate or
yes.
strawberry.
Yes, the diarrholite comes in different tastes. It comes
Okay,
in black currant, it comes in different fruit flavors. So if
okay.
he likes that, that would be a good idea, do you think?
Yeah, yeah, please, yeah.
Okay. Now, the other thing is, I see your worry regarding the kidneys, and that's very valid because obviously he has a number of other conditions, including his kidney function is already affected, it seems, long term because he
Mm-hmm,
has chronic kidney disease. So, we need
mm-hmm,
to be really careful in regards to medication here.
mm-hmm, mm-hmm.
So I'm thinking today you said his blood pressure was fine and his blood sugars were fine. I'm thinking it would be a really good idea to stop one of his blood pressure medications called as Ramipril, which can negatively impact his kidneys.
Oh, okay, okay. Yeah, we can do that, but it's just I'm worried to stop any of his medication, doctor.
Yes.
Can't you
Mhm.
come and give us a visit and see him, doctor?
Mm-hmm, mm-hmm. Of course, I can do a home visit if it obviously, that would be something that I would be happy to do. But at the while I arrange that, because I'm not entirely sure if it would be able to be done today or I can come tomorrow to arrange it. But given
Mhm,
that his blood pressure is fine, his heart rate is okay, I'm okay to give you a few instructions. So I would say we can hold off the Ramipril to make
mhm,
sure his kidneys are not affected. And
mhm,
then I'm also seeing that he's on a blood sugar medication to control his blood sugar. It is
mhm,
metformin. So,
mhm.
have you been aware of sick day rules regarding metformin at all?
No, no.
Okay, so whenever you have diarrhea and vomiting, it is always advised to hold the metformin for 48 hours, which is 2 days, because it can also affect the kidneys in a negative way.
Yeah,
Okay,
sure. Yeah,
okay.
yeah.
The rest of his medications, I feel they should be okay to take for now, but you need to be careful of a few things. If
Mhm,
you feel that his blood pressure is dropping, which is the above value is below 90, or
mhm,
his heart is racing, it is above 100,
mhm.
then these means that he is getting severely water depleted, and
Okay.
we need to make an assessment immediately or even bring him to the hospital if there is a need for hydration.
Okay, sure, sure, doctor. Yeah, yeah.
Mm-hmm, mm-hmm.
Mm-hmm.
For now, he's fine, and if you look after holding his medication, giving him some diarrhea, I will
Mm-hmm.
try to arrange the home visit in the best possible circumstance, either tomorrow or the earliest convenience.
Mm-hmm. Mm-hmm. Sure, sure,
Okay.
doctor. Yeah, 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 sure.
Do you have any other questions?
No, no, I'm happy with that. There is anything I can tell to the carer to do? You want me?
Just to make sure hygiene is very important, and hand hygiene especially, because just to make sure it's not spreading to anyone else,
Okay,
this
sure,
bug.
sure.
Okay.
Yep, yep. Thank you very much. Thank you very
Oh
much.
my god, it was so
Yeah,
bad.
no, no. Actually, I think your interpersonal skill, to be honest, is excellent. No, me as a relative of a patient, I felt you listened to me, and I felt I felt happy, to be honest, with the consultation. But there's little bit of tweaks. There will be always
Okay.
some, yeah, there will be always some, notes. Okay, that's why we are learning from each other. So,
Mm.
okay, so looking at the case, so you give me some reflection. Tell me, for how do you feel? If there is anything you would consider changing it, if
Yeah,
you
to be
repeat the case again.
Uh, like I see that it says toxin gene is detected, but
Mhm,
toxin is not detected. So, in
mhm,
my opinion, it shouldn't be treated with vancomycin, because if toxin is not positive, generally, like I remember of my hospital rotations, they
mhm.
didn't used to treat if only if the toxin itself was negative. So, but then it did say down below there that
Yeah,
review
yeah, which
clinical
is
symptoms
yeah,
and
which
treat if indicated. So
get
that
it.
was tricky for me.
Yeah,
But to be honest, I never treated anyone who was toxin
mm,
negative, no matter
yeah,
even if they have. So that was tricky
yeah,
for me.
yeah, which that's why I bring this case. Okay,
Hmm.
unfortunately, yeah, this is the usual concept. Well, if you find the gene there, no, you are not treating it, but this is not right. If you find the gene and the patient is asymptomatic, you are not treating it. If you find the
Oh,
gene and the patient symptomatic, then you need to treat, because it's suspected case. So any suspected case you need to
okay.
treat, and then we will see if he's truly infected or not. The symptoms will, the time only will say. Okay, so if he improve on the antibiotics, so most probably he was infected. If not, then so most probably something else causing the diarrhea. So this is the problem. Yeah. So C. diff can colonize our gut. Okay, and normally you can find it in the stool. So is it active or not? The only the only way will say is the symptoms. And with a patient who is 92 years old,
Hmm.
you don't want to miss anything in this age, okay? Because
Yeah.
yeah, they can rapidly deteriorate. And the other thing,
Yes.
which you also tricky. He already have a diverticular disease, isn't it? Diverticulosis.
Hmm.
So more or
Hmm.
less his gut is susceptible for flare-ups. So I don't think covering him with the antibiotic will be wrong. Actually, you need to treat.
Okay.
Yeah, so this is the
Okay.
first learning point. Yeah, so you
Okay.
need to treat him. Okay, if you
Okay.
find the
Okay.
toxins, well, so you will treat. But
Hmm.
also, by the way,
Hmm.
if you find the toxin and the bacteria, this is a
Hmm.
definite case. Okay, if you find the
Hmm.
toxin and also asymptomatic, although in the hospital rotation, if they find the toxin, they will treat.
Hmm.
Also, also is questionable because sometimes you can take the toxins from, by contamination. Okay, so
Okay.
again, you need to
Hmm.
depend on the, in the symptoms. Okay, so if
Hmm.
if the patient symptomatic, which I guess most of the cases will be symptomatic, because why you are doing stool
Hmm.
tests? I will not do stool tests for
Hmm.
nothing, isn't it?
Hmm.
So
Okay. Okay.
so yeah,
Oh, that
and
was
then
I was actually I read that but I got confused. I was
yeah,
like,
yep.
no,
No,
toxin is
no, no, you are
limited to
right.
maybe.
That's why we are discussing it, because
Yeah.
it's against what we usually, believe, okay? But when you read the guidance saying if there's symptoms, even proved or suspected case, you need to treat. Okay. The other thing is the other thing is, just having a look at the data there. So there is a lot of things there. First thing, that good that you confirm that we can discuss that or not. Okay. And also you need to confirm is only discussion or you have lasting power of attorney, or what exactly. Patient have
Mhm.
capacity or not, because you will go and visit him and you might tell him, in other cases, if this is severe diarrhea and he's completely dehydrated, this case was not, then perhaps you need to go and visit him in the same time, in the
Mhm.
same day. But the other trick, you can see when they call. I think the reception do love you on this clinic. So they put you this case at 6:20. I think it's only 10 minutes more and you need to go home.
Hmm.
So what you can do then, if this case needed to be seen, what you will be able to do? Would you risk it and go and see him, or what you will do?
But we can pass it probably on to the 111 service, isn't it?
Yeah, you can call the
Hmm.
out of hour, but the
Yeah.
referral process will take at least half an hour. I think if you went to
Hmm.
the patient and see him, especially if he's beside you, would be easier. Okay, which
Hmm.
you can. No one will
Hmm.
tell you why you went, just before your duty finish. Okay, but the
Hmm.
issue of how you will document, maybe if you have a laptop to document in, that will be better, because if you went, most
Hmm.
probably the receptionist will not stay. The reception will close will close the clinic. So
Yeah.
all this logistic, you need to think about it. Yeah. So
Hmm.
if say you are a partner and you have a laptop, this will not be a problem. You just go to, in your way, you are going home, you can go and have a look at him. Or the other option, as you said, you can refer him to the out of hours doctor. Okay.
Hmm.
And there is other option that you may utilize if the patient, you don't feel that it's maybe significantly ill. And I was hoping that I will hear it from you with this case, because if the patient have diarrhea and probable C. diff, you need to do some blood test, isn't it? You need to check
Hmm.
his CRP, you need to check his kidney function, isn't it? You
Right,
need
cell
to see
counts.
the
Yeah.
blood.
Yeah. Yeah.
So I would like to hear from you that you will call the district nurses or the
Hmm.
nursing hub and talk with them, and they can go, because they have long working hours, so they can send someone even out of hours. They can
Hmm.
send someone to take blood for him, and at least the blood will be on your system by when you come tomorrow morning, and then you can visit
Hmm.
him, the first patient in your list in the morning. You can do that. So
Okay.
this is one of the things that I'm doing myself. So something like that, I would call the nursing, please, if you can, urgently go and take blood for him. He's ill. He's 92. Bless him. I won't send 92 years old to the hospital except if it's
Hmm.
extremely needed, isn't it?
Hmm.
And
Or can I
so,
ask you one question here?
yeah,
In
sure.
regards to you were saying that we can send the nursing,
Yeah,
the nursing team over to his
yeah,
house for
yeah.
phlebotomy and basically
Yeah.
to have the bloods. But that would only be possible if he is a housebound patient, isn't that right?
Yeah, but then he have carer because he's housebound. Why
Uh,
he have carer then?
mhm,
He is deaf. He cannot hear. He is hemiplegic. Okay,
mhm,
have suprapubic catheter and
mhm,
suprapubic catheter because he have massive BBH,
mhm,
and they find him he's not fit for surgery. Okay,
mhm.
so that's why he's
Okay.
indicated to call the nurse, but you call them because sending referral that will not reach them the same day. You need to call
Mhm,
the nursing hub, speak with them, to reflect to them what is the importance of doing the blood today. Otherwise they will feel that you are just bothering them by additional work. Okay, they need to
mhm,
know why it's important, and they will be very cooperative. They never turn me back, to be honest. They are very cooperative once you call them and they know that, okay, and it's true emergency, they will just go, they will find time to go. Okay, so call them, and it's always important when you go to work in some place to ask the reception to give you the nursing hub telephone. Okay, you need to have it, always have it. Okay, so this is my advice for you. The other thing that you can see, yeah, you can see you have a massive list of medication. You did stop some
mhm,
of them, but not all what I like you to stop, to be honest. Again, this we will discuss it. Um,
mhm,
Coming back also to his all comorbidities, so that's add to his additional risk, and these all comorbidities and 91 years old all are risk for C. diff, isn't it? But the major
mhm,
risk factor for him having C. diff, which also why this case is tricky, that he have carers, and this is a big
mhm,
problem. These carers are going from him to another one to third one to fourth one, and most probably they will just spread the infection. So maybe he get the infection from the carer. So this will need to be enlisted, but you save it in the last minute when I told you don't want anything to be said to the carers, but you never we don't know if they act a true actor, for example, will tell you something like
mhm,
that. Okay, so take care
mhm.
whenever there is gastroenteritis or infectious disease. You need to give little bit in the management regarding
I
how to prevent
see.
the infection. Okay, it's very important.
Mm, mm,
Okay, so coming back to the feedback, so I like you did use the pre-existing information. Maybe it was not clear for you that they send the stool analysis to the stool to be analyzed. Okay, but it's written here, relative sent stool to analysis. So this you didn't use it, but in general you did use the name, maybe the name of the patient, but it's clear also written down there that Son John White House will call. So you need to clarify who's you're talking with, and and if the relatives see that you know him, that will make the rapport better and will make your life easier. Because once the relative or the patient trusted you, your treatment plan will go smoothly. If they didn't trust you from the beginning, which simple things like this can make the patient not trust you. Okay, that you didn't maybe notice that they send the stool culture, you didn't notice that, oh, he is elderly, not properly hearing, and usually his son, he's the one who's taking the decision. That will make them little bit suspicious, especially if they don't know you. Okay, so if they don't know you and you are a new doctor in the clinic, that will make them little bit not happy. So take care of these simple things, but it's simple but crucial. Okay. The second thing, I hear some differential. I hear that you ask about the changes in the bowel. I think you ask about that because you are worried about cancer or both, isn't it? Or
Yeah,
overflow
I was also
diarrhea.
thinking around ischemic bowel as well because he has cardiovascular disease. He's
Yeah,
treated
yeah.
under hypertension
So,
and things.
would you find it a problem to just verbalize that?
Okay, okay.
Yeah. So because the patient and the relative don't know what's your thought process,
Hmm.
as well as the examiner or me myself, I don't know your thought process. But
Hmm.
if we hear your thought process, that will make your consultation very logical for you and for the patient, and then you will not forget any different, you will not forget your part of your questionings. And even if you say you want to ask about, risk of dehydration or he's dehydrated or not. So, okay, can I ask a few questions to make sure that he's dehydrated or not? Is he having urine output? Is. So if you
Mm,
ask one or two without asking the rest, then you will not be down market. Okay, so
okay.
already we know that you are thinking in this. You don't need to nominate all of the, dehydration signs. But if you didn't say it, then you need to nomad them all, because if you forget one, then you can be down market. You got what I mean? So
Mm,
always put
mm,
your topics or your differential in headings. You have your headings. Okay, ischemic bowel. Second thing, cancer. The third thing, it's true infection. So I will ask about fever and the rest of it. So you can tell him, okay, just to make sure this is he have infection or not. Did he have any temperature? How's his eating? How's his drinking? Is he having vomiting or not? And then you can say, okay, that's reassuring. If there is no fever, that's something good. If he's drinking, that's also something good. At least he will not be dehydrated. But coming from that, what about his urine output? I can see he have a catheter. If the catheter is draining or not, how much it's draining? Do you think he's dry? Do you
mm,
look at his mouth? Do you think his mouth is dry? Because sunken eye, usually old age you will have sunken eye, isn't it? All the fat are depleted, and the periorbital fat will not be there, isn't it? So
mm.
very difficult to to judge the dehydration in elderly people with that. So as well as you cannot also judge it with the skin turgor, because already their skin has lost its elasticity. So these are the tricks with the elderly population. Okay, you can't depend on the normal things, but tell him, okay, just open his mouth, put your hand in his mouth, or do you see any saliva? How is his saliva? Is his mouth is dry or not? Okay, which is simple things.
Mhm,
Yeah. And then you have to ask about bowel changes. Okay, is he having constipation from before? Because sometimes, the buildup of the stool in the stomach
yeah.
or in the
Yeah,
bowel
yeah.
can have, yeah. So just
Mm,
nominating it will be good. Okay, that will make your
mm,
consultation more flow and more logical. The other thing, the red flags, well, does he have blood in the pool or not? Because this is the
mm,
culture, yeah, it's not stool analysis. I can't see any stool analysis. They make culture, so I'm not sure if there is blood. So also ask him if there is blood in his stool and while he's passing, the stool and the stool is watery. Does he have any pain in the back passage? No, no, no. That's good. That's reassuring. And then move forward to the ice. Yeah,
mm,
your ice was fine, but usually when when you ask ice, better to give the patient an idea that you have a plan for him. Okay, you are not asking his opinion because you don't know what is going on. Otherwise, he will think you don't know, and you are just wasting the time or asking his opinion. Okay, so you don't need to say do you have any idea what's going on? Say, okay, I have the blood test in front of me. I have a couple of things that might cause his diarrhea, but before going through that, would you have any thoughts yourself?
okay.
Okay, yeah,
Yeah,
so he will know that you have a plan for him, and he will feel more confident and comfort. But asking him, oh, do you have any idea what is happening? So are you insulting me, asking me that I don't know what I'm talking about? This is one,
mm,
or you are asking me because you don't know and you want my opinion. I'm not getting. Yeah,
I
so
understand.
yeah,
Okay,
yeah.
good
And
feedback. Yeah.
then concern, yeah, you heard his concern that he's giving I can hear your concern. You are giving the lobramide and the diarrhea is not stopping, but was there is any other concern you want us to address today? Okay. So like that, you will take marks in the active listening. So anyone will hear you will know that you are already, you are recalling all what he told you. Okay. And then expectation, okay, other than you want something or you want to, to know what is the blood test, because already he knows that this, not the blood test, the stool test, he knows already that this appointment is regarding discussion of the stool analysis. So other than discussing that, was you expecting anything else from me today? Then he would, open up and tell you what he would like. Okay, is that clear in the eyes? Hello?
Yes, yes, that's
Yeah,
clear,
is
doctor,
that
and
clear in
it's
the
it's a
eyes?
very
Yeah,
good way to explain it because I
yeah,
always struggle with how to ask eyes, so
yeah.
that's a good way. Thank you.
Yeah. Then the management started at 4:45. So usually with the management, I would like always if you can start the management at 5:30 or 6 minutes. And then in the management, we already said you need to say, yeah, the C. diff. Don't say it's normal. You say since it's one of the bugs and it's symptomatic, we need to treat. But do you know what is the treatment?
Yes, I know it's vancomycin 125 milligram QDS for 10 days.
Yeah, excellent, excellent. And then after that,
I don't know. I think we have to reassess them, but 2 weeks time to see if their
yeah,
symptoms
to reassess what? Because this is important. To reassess what?
symptoms.
Yeah, exactly. To
Hmm.
reassess the symptoms. So they need to have expectation that the diarrhea will not usually stop even after the 10 days. Otherwise, they will keep calling you, well, the diarrhea didn't stop, doctor, the diarrhea didn't stop. Then they need to know that the diarrhea might stop after 2 weeks from subsiding of the antibiotic. Okay, this is one. The other thing, y- sometimes you can have recurrence or reinfection. So, and the recurrence and reinfection, the timeline difference between them is 12 weeks. So take care from that. And the third thing, you cannot repeat the stool for C. diff testing except after 1 month, okay? Because usually the toxin will stay there and some of the spores can be there. So the most of probably the microbiology will refuse to do the stool test again except after a month. So these are the points that you need to keep in mind rather than, keep asking about the stool and then they will give you the sample and then it will be refused by the microbiology. Coming back to okay, the sick day rules. Okay, sick day rules. There is multiple medication here needed to be stopped. I'm completely with you about the ramipril and the metformin. But what about the diuretics, the fusimide? What about
Yeah, I
the
was dapagliflozin.
dapagliflozin?
Yeah,
Yeah, which
dapag. I
is more
actually didn't have
dangerous.
time for that.
Yeah,
Yeah.
which will more dangerous. If
Hmm.
fusimide will just knock off his kidneys, and the dapagliflozin is, the worst from for dapagliflozin. He can cause DKA, and the DKA is normoglycemic. So don't be happy that his sugar level is normal. So the
Hmm.
problem with the dapagliflozin is causing what's called euglycemic DKA, which is very tricky to diagnose, except with checking the ketones in the blood. And unfortunately, not all of the us having in their surgery ketones ketometer. So take care of that. So need to stop it. I won't be. I will not stop glycoside because this patient needs some anti-diabetic medication. Except if he start to have hypoglycemia, then you can stop the glycoside. And the other thing, the atorvastatin. Any patient on a statin, the statin usually is causing diarrhea. So also you need to stop the statin, not because of the sick day rules, because the statin is by itself causing diarrhea. So I would strongly advise to stop statin as well. And to be honest, 92 years old patient, why he's on a statin? No, he's bedridden,
Hmm.
massively frail. So this medication need to be reviewed. Okay, so and this is a good time to stop it and tell him actually he doesn't need it, and we might consider stopping it for forever. Okay. Um, yeah, and then after that, yeah, which is also important, yeah, I got that to start the aerolite, but then what about lubramide to continue or to stop?
It is best to stop that.
Yeah, sure,
We
sure.
shouldn't continue, doctor. Yes.
Lubramide will
Hmm.
keep the toxin and can cause
Hmm.
paralytic ileus.
Inflammation. Yeah.
Yeah, can precipitate for toxic megacolon, and this is the last thing that you want to do for that patient. Okay, and then the
Hmm.
carer advice, and tell the carer that please, they need to be strictly for hand hygiene, and especially if they are going to another carers and other patients. Otherwise, they will be source of transmission of the infection. You don't want a local endemic for your area because at the end, a lot of people can die from simple preventable infection like C. diff. And then at the end, doing the blood, don't forget renal function, CRP, white blood cells, because all of these are markers of of severity. Okay, if the white blood cells is high, CRP is high, okay, kidney function deteriorating, all of this are indication of admission. Okay,
Thank
clear?
you so much.
Yeah,
Yeah,
no
this was very
problem, no
helpful. Yeah.
problem. I will share the PowerPoint. Just please, if someone can tell me if the, let me share it first, and then someone to tell me if it's shared or not, because I don't want the problem that happened last week to happen again. Let me share Windows PowerPoint. Is it there, the PowerPoint?
No, we can't see.
No? Now?
I
No?
can see it. Yes, yes.
You can see?
I see a
I
level
see.
up. I can
I
see
see a
it.
level up.
Yeah, you can see. Okay, good, good. So the ECG will come to it after discussion, just to go through the PowerPoint of the C. diff. Okay. Um, Yeah, so here, this is the PowerPoint of the C. diff. So C. diff, it's, the spore forming, and this is the dangers of it, that it's spore forming organism, okay, very resistant to alcohol. So even alcohol wiping will not kill it. The only way is to do simple hand washing, okay, and it producing its symptoms by exotoxins, okay, which A and B. You can see here, so this is a normal gut. Okay, after infection at the end, you can see it's making necrolysis of all the lining of the intestine, and that will decrease the absorption. Okay, and then most of the nutrient and electrolyte will be depleted from the patient body. Okay, this is what I was explaining, that C. diff can be can live in our intestine. Okay, especially with babies. Okay, they can be only commensal, but they will not be problematic except if the overgrowth of the normal microbiome. Okay, and perhaps when you finish your exams, please start to read, more about what is microbiome, what is normal gut flora, because it's an upcoming, important knowledge. Okay, and there will be a lot of diseases will be the key of treating them will be through the microbiome. And I think this will be the future of the medicine, perhaps. The other thing is how you can, so if this patient is taking an antibiotic, okay, how you would be able to differentiate, is this as a C. diff due to the antibiotic, or is an antibiotic-induced diarrhea? This is also an important question. So say the patient have diarrhea, you want to send the stool sample and then before sending the stool sample, you will have, what's your opinion? Would this really will be C. diff, or it's an stool or diarrhea because of side effects, for example, of coamoxiclav? So the timing of the diarrhea is very important. So usually the C. diff induced diarrhea is started from the day 4 to day 9 of the use of antibiotic, but the antibiotic-induced diarrhea will be in the first or second day. So the timing of the diarrhea and the administration of the antibiotic is also important. And why it's important, not only because of the infection, the other thing, because antibiotic-induced diarrhea, you can use lobromide, you can use Imodium for treating it without being worried about anything else. Okay, so that's why it's important to differentiate that. And then the risk factor, we said elderly, immunocompromised, antibiotic, namely fluoroquinolones and penicillin, which also surprisingly clindamycin as well. Okay, carbamazepines, I don't think we will have a lot of encounter with them, except if you have a patient that having hospital at home and the nurses are administering the drug for them, or the patient are recently discharged from the hospital. So the carbamazepines can then be considered as the offending drug for having C. diff. Okay, and if the patient have, surgical operation, history of surgical operation. Okay, how C. diff is spread, most probably, contamination. And this is the difference between colonization and infection. And and here this is what is a colonization patient do test positive for C. diff organism and toxins. And the only way to differentiate that is being symptomatic or asymptomatic. If the patient symptomatic, treat. If the patient is symptomatic, usually you will not treat. The risk factor again, age by itself is a risk factor. So if the patient more than 65, this is a risk factor. Less than 65 with multiple comorbidity is also a risk factor. Um, don't forget any diarrhea. You need to do full blood counts, renal function, okay, and I would add also liver function and CRP plus the stool. This is one slight summary of treatment of C. diff. Sorry for the the shortage. So the shortage is shit. I'm so sorry. It's just this is the shortage. So the S is for the severity, and you can assess the severity depends on the hydration status, the abdominal symptom. Because if you went to visit this patient and you have rebound tenderness, this means that you have peritonitis. You need to be referred to the hospital urgently. The white blood cells, creatinine, having fever or not, and the frequency of the stool. But keeping in mind that frequency of the stool, you don't need to depend on it much, because the patient can have very severe illness and dehydrated, okay, but have less frequent stool because he is already depleted. So this is something you need to keep it in mind. Don't depend only on the frequency of the stool. And then hospital or home, depend on how severe or and the bad is the infection, and then what to stop. Do we need to stop the antibiotic or not? It depends. If the patient taking the antibiotic, if he's on antibiotic and taking it because of life-threatening sepsis, then you would consider changing the antibiotic to, to any other antibiotic than the four mentioned previously antibiotic. But if he's taking the antibiotic for something not life-threatening and the C. diff infection is more life-threatening, and the vancomycin is not covering this infection, you would consider stopping that and start the vancomycin by itself alone. Okay, and these are the drugs for the 6-day rules, which is namely diuretic ACE or ARPs, metformin, and non-steroidal. And please, please, please don't forget dapagliflozin, because it's not mentioned in a lot of unfortunately a lot of textbooks, because dapagliflozin is in the market for from 15 years also. Relatively is a new drug. So if you are reading from an old reference, you won't find the dapagliflozin there. And then if the patient already on laxative or PPI without a significant indication. So if he's on omeprazole and there is no specific significant indication, not on Barrett's esophagus, for example. If Barrett's esophagus, I would keep the PPI, but if he's taking it for simple gastritis, I would stop it. Okay, and the last thing, don't put him on lopramide. Treatment will come to it is vancomycin, rehydration, and infection control to prevent the spread. And then these are, I strongly advise, if you will start any patient in any of these drug, ACE, ARPs, non-steroidal, metformin, dapagliflozin, please, please, please try at least to send the 6-day rules and guidance to him in his phone, or even print a card for it. You will just Google it. You will find a lot of cards of 6-day rules. You can print it and give it to him and keep it with him so he can, have the power of stopping, his medication when he is sick. Okay, and that will make a big difference in the outcome of the patient. Okay, and this is a repetition of the severity, home or hospital repetition. I spoke about these. I spoke about that. Treatment. So treatment, what's important, we are treating suspected or confirmed case of C. diff. So once suspected, it's better to start treating. The first line is vancomycin, is not metronidazole anymore. Also, if you are reading from all the resources, you will find that metronidazole is the first drug of choice. It's not anymore because there is massive resistance for community-acquired C. diff infection, and it will not be beneficial. Okay, you will just give it and the patient will deteriorate. However, after 10 days, if the patient is not improving, you feel that the patient is still having issue with his symptoms, okay, i.e. still having nausea, having fever, then the second a choice would be the fidaxicilline, okay, and it's 200 milligrams twice daily for 10 days, and then reassess that. If it's still symptomatic, you might need to ask the microbiologist consultant or even refer the patient because some cases would be very resistant, and then you need to add an add-on IV metronidazole, not oral metronidazole, okay? For the symptoms, it should improve after, you know, 2 weeks from stopping the antibiotic, okay? But then if the symptoms recur again after improvement, so now we will go to the 12 weeks time scale, okay? If it's before the 12 weeks, this means then this is a relapse from the vancomycin. Vancomycin was not strong enough to cure the infection totally, and then you will have only one choice is starting the other antibiotic, fludarabine. Okay, but if the symptoms recur after 12 weeks, this means that you can use either vancomycin or fludarabine because it's reinfection, and reinfection mostly will happen if the carer didn't take care about the hand hygiene because it might be they are the one who's introduced the infection for such patient. Also, this is very important to understand it. Okay, there is an advanced treatment for very resistant cases. It's called microbiome transplant. I didn't see it locally with our hospital. I heard about it, saw some videos about it, but I don't have experience about it. Okay, they will just bring some, you know, um, bacteria, the normal bacteria, normal flora from a gut of another patient and transplant it to that patient, and that will improve the symptoms. I'm not sure about how it will be available around, perhaps maybe in London, I'm not sure. Okay, but I didn't see it locally in our hospital. We spoke about that. When to repeat the stool sample, that's important. You will not repeat stool sample before 28 days because it can be false negative. Okay, and then prevention, the prevention would be, don't start, I hope all of you know what is stewardship antibiotic approach, okay, which is limitation of the use of fluoroquinolones, limitation of the use of penicillin medication like coamoxiclav, except for the cases that it's truly needed in them, okay, and the clindamycin, and hence you would prevent the infection from happening, and then um, hand hygiene and the rest of the infection control measure. Okay, these are the case of the C. diff. I will stop the recording for that case. Okay, stop recording.